Hey everybody, my name is Brandon Kirshner and I'm the founder of Univoxa. Now before I get into what Univoxa actually is, I want to talk a moment about how Univoxa came to be. So back when I was a second year medical resident, I went through a very significant period of burnout. Now for those of you that don't know, second year residents are supposed to know everything while actually knowing absolutely nothing. I still feel like that sometimes today, but that's a different story. So my clinical duties were piling up. I had 3 or 4 kids at home, I can't even remember at this point, and I just felt off. I wasn't clinically depressed, I don't think, but something wasn't right. So I took a deep dive into the world of mental health, and I decided to run a little experiment with my residency program. I went up to 4 different colleagues and told them one fact about myself, mental health related. I walked up to James. I said, James, I haven't slept in 2 weeks. I'm depressed about it. It's affecting my work. I don't know what to do. Help me out here. And he said, well, resiliency. This is residency. Move on. I walked up to Jayla. I said, Jayla, I don't want to do anything anymore. I don't want to play pickleball with my wife. I don't want to go golf. I just kind of want to sit in my room and sulk after work. And she said, me and my boyfriend went through the same thing. You'll get over it. It'll happen. I then went up to Dr. Cow. I said, Dr. Cow, I can't stop thinking about that case we had last week about that lady who died. I feel bad about it. I feel guilty about it. And I don't think we did justice to the family. Frankly, I haven't eaten. It's making me depressed. And he said, it's good you're learning about this as a resident now than when you become an attending later in life. Now, finally, I walked up to Sebastian. He's my good friend. He's a farmer type. This was very uncharacteristic of me. But I walked up to Sebastian, and I said, Sebastian, I just bought a gun. And I remember he looked at me in the eyes, he put his hand on my shoulder, and he said, finally, what kind did you buy, and when can we go shoot? Now, this is why this matters. Sebastian is not a careless person. In fact, he cares deeply about me and deeply about the team. So what was he supposed to do in that moment? Was he going to file a formal report, tell my program director, ask me if I was suicidal or depressed? Of course not, because the current system in place makes escalation feel extreme. So what did he do? He minimized it, he normalized it, and he moved on. Not because he didn't care, but because there was no infrastructure in place for him to say, this doesn't feel big, but it also doesn't feel like nothing. If I were to walk into my program director's office and tell him those 4 things that I spread out across everybody, I would have immediately been screened for burnout, depression, and suicide. But you know what came of that experiment? Absolutely nothing. Nothing. It's not that these people didn't care or that they were bad people or didn't have compassion or empathy. It was the fact that my signals were scattered, were fragmented, and no one had the whole picture. No one could take my signals and aggregate them into a voice on my behalf. Now, I could have done it myself, but I was known as the tough doctor in the group, not the sad doctor. So that led me to ask a bigger question. What kind of future and what kind of safety systems do we want for our institutions going forward, especially for those with high-risk groups such as medical residents, EMS, fire, military, blue-collar, and even academia? The current systems are reactionary. They don't aggregate signals. They wait for crisis to occur, and then they respond. Or they require an individual to step up, be brave, and say, hey, I am struggling. And we all know that's not usually the way struggle appears. It's not a failure of empathy. It's a failure of the way our systems are designed. So that is why I built Univoxa. Univoxa is a mental health platform designed for high-risk groups that takes peer-inputted microsignals and aggregates them in the background to notice patterns of concern within individuals before a mental health crisis or sentinel event occurs. Univoxa is simple but deliberate in its design in that it keeps those putting signals in anonymous and those who the signals are about anonymous as well through a proprietary aggregation threshold mechanism that keeps their data completely private unless a pattern of concern is recognized by the Univoxa system. Now, those thresholds can change based on institutions, but the core concept remains the same. Organizations deploy Univoxa kiosks in shared secured spaces. There are no apps to download. There is no logging in. There are no usernames. There are no passwords. Only publicly available kiosks that do not require a login to use. There is no data tracking. If an individual is concerned about a colleague, they can go to a Univoxa kiosk and submit a structured signal. No rumors, no free text box, just a guided submission based on current validated clinical indicators in the world of mental health screening today. Now here's the key. One of those signals, individually those signals don't mean much. One signal, nothing happens. 2 signals, 3 signals, nothing happens. But if a person receives a number of independent signals coming in over a set rolling time period that pushes them over the safety threshold, their name is given to leadership, and leadership is notified immediately so that they can intervene before a mental health crisis or sentinel event happens. Now, Univoxa is not asking Sebastian to become a whistleblower. It is only asking them to add a responsible data point to a shared safety system. He doesn't need to escalate. He doesn't need to judge. He doesn't even really need to be certain. He just needs infrastructure in place to say, I had an interaction today. It felt off. Here's a data point. Do what you will with it. So, when we think about the future we want, especially for our institutions and high-risk groups, I think it's this: a new category of institutional infrastructure that is proactive and preventative before mental health crises and sentinel events occur. And furthermore, I hope that we never use the phrase, I didn't see the signals, or worse, I saw the signals but didn't see the whole picture ever again. And that is why I'm building Univoxa. Thank you very much.